Good afternoon. My name is Dr. Sanjay Suresh, and I am taking Bio 1030 Pathophysiology course at University of New England. So today I'm going to be talking as a part of my project on pancreatitis. Now, what do we mean by pancreatitis? Pancreatitis is the inflammation of the pancreas. The pancreas, and what is this pancreas? The pancreas is an organ that is located in our abdomen, the upper abdomen. It's located in an area called the epigastric region, and it is responsible for creating insulin and also producing digestive enzymes, which are necessary for digestion of the food. Now, how do we classify pancreatitis? We have two different categories. The first one is acute pancreatitis, which is sudden in onset. It doesn't need much time. It could be sudden in onset. And the second one is chronic pancreatitis, which gradually occurs over a prolonged period of time. So these two are the classifications. And now I'm going to talk about the etiology of pancreatitis. What are the causes? When we talk about etiology, we have to talk about the causes. So what are the important causes that lead to pancreatitis? One is alcohol abuse. So if you're a chronic drinker, if you take lots and lots of alcohol, this could damage your pancreas and it could lead to pancreatitis. The second most important etiological feature is obstruction of gallstones. Now, gallstones, the blockage, this could lead to the severe infection or damage of the pancreas. So gallstones could lead to pancreatitis. And also obesity. Obesity meaning increase in triglycerides. If you're obese, if you're fat, this could lead to inflammation of your pancreas. Also, pancreatitis could be seen due to hormonal imbalances, mainly the fluctuation of insulin and glucagon, which is responsible for maintaining our blood sugar levels. These two hormones could lead to pancreatitis. And also, pancreatitis could be hereditary, meaning if you have somebody who has been infected with a pancreatic condition in your family, then you could also be affected with pancreas, and this is seen in childhood. So these are all the main important etiological findings of pancreatitis. Now, pancreatitis is mainly associated with a syndrome called cystic fibrosis, which is a condition that leads to severe malabsorption and increased fat. So pancreatitis and cystic fibrosis they have a very nice correlation with each other. Now, coming to the signs and symptoms, what do we see in a patient who has the condition of pancreatitis? Well, a person with a pancreatitis, they could have severe abdominal pain, and the abdominal pain is present in the epigastric region. It could radiate to the back, and it's also present with flank pain. And the second thing, and the other couple of features, is you could see fever, high amounts of fever if you're infected, and tachycardia, that means increase in heart rate, hypoxemia, that is low amount of oxygen, and also you could see jaundice. This is a sign. Jaundice is also an important sign. This means the yellowish discoloration of the skin, and also abdominal distension. If you're a clinician or if you're a physician, you see an abdominal distension. This could lead to a condition that, along with the pain, you could come to the feature that you might come to a conclusion that this is pancreatitis. Also, hyperglycemia. This is also very important. So increase in blood sugar. So this is also seen in diabetes. So diabetes, where you have the antibodies that attack your beta cells, this destruction could also lead to diabetes mellitus. So hyperglycemia could be a condition of chronic pancreatitis. And also you could see weight loss, steatorrhea, that means presence of fat in the stools. These are all features and signs and symptoms that we could see in a condition of pancreatitis. Now, what are some commonest tests that are used to determine how do we find out whether we have pancreatitis or not? Well, one thing is we could check the blood sugar level. So hyperglycemia, that could lead to increase in pancreatitis. Also, we could also measure the leukocyte count. If you have an infection or a secondary infection, you could measure the white blood cell count, which might lead to a condition of pancreatitis. and also measure the triglyceride levels. If you have increased triglycerides, this may be associated with pancreatitis. And CT scan is an important. So CT scan, this could be due to necrosis or fluid accumulation. This is also called a pseudocyst of pancreas. CT scan could also is a very important method of finding out whether you have pancreatitis or not. Also, the ultrasound for any gallstone obstructions, you could use the ultrasound. Now, let me just talk to you about the differential diagnosis, one condition that could be differentially diagnosed from pancreatitis. One important differential diagnosis is peptic ulcer disease, which is an ulceration that is present in your stomach. And how you could differentiate this from pancreatitis is in peptic ulcer disease, you could have hematemesis, that is vomiting of blood. You could see presence of blood in stools. And also, you see pain after intake of the meals. When you differentially diagnose it in pancreatitis, you don't have anything related to blood. You're not vomiting blood, you're not coughing up blood, or you're not excreting blood in your feces or stools. So this is one important differential diagnosis. You will see black tarry stools in peptic ulcer disease, but you don't see this in pancreatitis. So this is one important diagnostic differential diagnosis of pancreatitis. Now I will talk to you about the complications of pancreatitis. Now, one important complication is pseudocyst, which is a fluid accumulation that is present in the pancreatitis, and you can see this through the CT scan. And this is an important complication of pancreatitis, and this could also lead to infection. And the second most important thing is complication is you could have weight loss, heavy excess fat secreted in the stools, and also hyperglycemia, which is also related to diabetes. And another important feature of another important complication is carcinoma of pancreas. It's chronic, severe. If you have pancreatitis for a prolonged period of time, you're also prone for carcinoma of pancreas. So the important complications, let me just highlight to you, is pseudocyst, hyperglycemia, diabetes, weight loss, and cancer of pancreas. So these are the important features, important complications of pancreatitis. I hope you got a lot of information from this video, and please send me a thumbs up, and please subscribe to my channel. Thank you.